Hi, Adam Woodbridge is my name, and I'm an orthopaedic surgeon. And today I'm here to talk to you about osteoarthritis of the knee and its treatment. Uh, Osteoarthritis of the knee is a condition where the joint loses cartilage cover of the bone and ultimately ends up degenerating to the point where there is bone-on-bone contact, which causes you significant pain and loss of function. And the treatments for this condition are varied, and there is a multitude of treatments available that we need to decide depending on how it suits your particular knee. So in the early stages of osteoarthritis, the simplest treatments are done first, and these include activity modification, weight loss, simple analgesics, which are non-addictive, and quadriceps strengthening, which allows less pressure to be put on the worn part of the knee. And in many cases, this can be enough for some patients in their early disease, whereas patients with more advanced osteoarthritis, where there is significant effects on the patient's quality of life and their daily function, and often patients with night pain may even need to have something more invasive done, up to a total knee replacement. Now, what do we do with those patients that are in between that stage where they have more moderate osteoarthritis? Well, there's other options available as well, apart from the simple treatments. The next level of treatment would be injection therapy. So the most common form of injection therapy would be a cortisone injection, and this can be quite effective, but it is fairly short-lived. And so sometimes I'll use that for perhaps someone who's going away on a holiday where they need to walk greater distances for a short period of time, or if someone has a large event on in their life. But it's generally not the most lasting treatment. The next form of treatment would be a hyaluronic acid injection, and this can be useful for up to 6 months, but generally only works in patients with mild osteoarthritis. In cases where patients are not quite bad enough for a major surgery, but also are not responding to some of these simpler measures, then one of the newer treatments that I've had experience in is radiofrequency ablation. And this is a procedure that's reasonably minimally invasive, where 4 needles are carefully placed into specific areas around your knee under image guidance, and then the probes are heated to a specific temperature of 60 degrees, which allows the fine nerve endings around the knee joint to be treated, but normal tissue is not affected. And so this essentially reduces the amount of pain fibers that can send pain signals back to your brain. And so the effect of this is that it doesn't change any wear or tear in the knee, but it reduces pain in many patients. It generally lasts on average up to about a year, and it can be used as an adjunct in treatment. So the sorts of patients that seem to benefit from this are patients that have reasonably advanced osteoarthritis but aren't quite ready for a knee replacement, or aren't quite bad enough for a knee replacement. And there are also some other niche situations where I'll use it. So, for instance, I have a patient who's coming up needing a knee replacement on one knee, and whereas their other knee has moderate wear that is also affecting them, but not quite as much. And so I'm going to do a radiofrequency ablation on their opposite knee. Other patients that have done well with this are people with focal wear in, say, one part of their knee, like in the kneecap, where it seems a shame to replace their whole knee. and quite often a radiofrequency ablation could be enough until they go on to develop more advanced arthritis later. I have had patients that have been very overweight and in the process of losing weight, and so they preferred to have their knee replacement done once they'd achieved their goals, and this has helped them to be able to achieve that by just giving some pain relief for a temporary period. And after all of these options have been exhausted, then the final solution for most patients with osteoarthritis of the knee is to proceed to knee replacement